Welcome to Tea or Coffee on High Impact Television. Good morning to our viewers. Good morning right from Nigeria, Lagos, Nigeria. It's a beautiful morning. It's Wednesday. And yes, you're on to Tea or Coffee. And like we always like to say, our TV, the first full HD television station in Nigeria. Yes, first full HD. We're so proud to tell you that any time of the day. Yes, my name is Wura Olapopola, and with me in the studio, I have the gorgeous and beautiful Sheung.
Good morning, Wura.
Good morning.
How are you?
I'm fine.
You look gorgeous too.
Thank you.
You're a breath of chocolate gorgeousness. No, please don't blush.
No, I'm trying. I'm actually trying. Thank you. Good morning.
Yeah, so
and you look beautiful. Did you have to wear black also?
I know. See, it was just an inspiration. I didn't know that you were going to wear this, but then I saw you and I'm like, oh, really?
Oh, well, you still look good.
Thank you.
Okay, so, you know, yesterday we had Ronke on the show and we talked about this viral video of Dedenne from Umaya, who is popular to, who is known as misspelling words. And yesterday we looked at the, he has many videos, but we looked at the specific one of Spell Buhari, where he could not spell Buhari and he was asked to spell Buhari, B-O-N-I. No, actually, a lot of Nigerians, you know, picked up that video and they saw it as a way to comic relief, or they made fun of the video
so much.
But then we had to look at it from the other side of, okay, fine, we understand that he can't spell and this sounds funny, that there's someone who cannot pronounce or spell the name of the president, Buhari. But then, have you looked at this side of helping this person, you know, not using this weakness against this person, but helping this person come out of this? And like as we said yesterday, Ronke was like, okay, fine. Have you looked at if he has psychological problems?
Because it looked disoriented, actually.
Yes,
it looked like it was not well put together. And then, on seeing the video, I'm like, wow. Of course, you know, this is Nigeria. Practically anything can trend. It went viral. And I'm like, this is not the first time that something like that would go viral. Like something that, you know, there's this sad thing that is gradually rising. In fact, it has risen, Seth. When things are going wrong, when there are situations that call for urgent attention, sometimes it's even in the sport of accident victims and incidents, and then you see people whipping out their phones.
That's the first thing.
It's really sad. You see sometimes people crying for help, shouting for help,
and then
bleeding,
you are recording. I wonder where the human conscience is, where
on a journey, a long journey,
something you were supposed to like help out, and then the first thing you can think of is how to pick up your phone and record such incidents. But the good news, actually, because a lot of people don't even know his real name. Most people just say, okay, the Spell Buhari guy.
Yeah.
Even when you want to search for the video, the first thing you type is Spell Buhari.
That's sad.
But then he has a name, didn't he? But one thing I'm just happy about is the fact that some Nigerians sat down, you know, to help him. At least look better. Changed his wardrobe, took him out for shopping, and some have realized that he needs psychological help.
He needs more than the wardrobe upgrade and all that.
Someone that, you know, could help him in this situation, because I feel it's some sort of a mental issue, and instead of people to look beyond how they could help him, look beyond the challenges, all they are doing is
just to laugh,
bringing out beats and people dancing to it. But then Ronke mentioned something yesterday that if we could have someone like him, then trust me that there are other people like him also that are yet to be discovered that cannot pronounce or spell. And if, you know, we can use him as a case study to help him and come out of this situation, others would also, I'm sure he would look out for people like him and also try to help them. And we talked of the issue of Taju, the little boy.
Oh yes, I saw that one too.
How old are you? And he's like, I don't know what how old are you is. And now I saw the picture on the internet. He's looking better.
Packaged. You know, it was really looking good. And, you know, the first time I saw the video of Taju, I was, at first, I was amused, but then I had to pause. I'm like, this guy, at his age, he should be spelling. You know, they say reading starts at 3. And I think he's 4 years old or plus.
Yes, and he cannot
he couldn't. And then the
he
guy
didn't understand.
And he was like, he does not understand in Yoruba. Like, and he had this confidence, like he was quite confident, but then he couldn't.
The same thing with Day Day. Like, there's so much confidence in saying, and then the people who went like, made him feel like what he was doing or what he was saying was right.
They were golden in one,
so
and
much
he kept
confidence
on going.
in misspelling words. I mean, and all you can do is put it out on the internet for your own fame. And remember that this fame is not going to last for long. Because trust me, if someone is saying something about you now, by tomorrow, something else would happen that would make them talk.
Exactly.
And forget about what you probably did yesterday. So why would you put someone's challenges or weakness out there just for you to be famous and for your video to go viral, or for you to have viewers and followers? I don't feel it is right for me. I've seen situations whereby accidents happen on the road, and then you see people bringing out their phones. Rather than, you can use the same phone to even call the emergency center to help them.
Or even you can offer some form of first aid right there. You could help the person out of that misery right there. You know, I have this particular problem that in Nigeria, any little thing can trend. The most mediocre
and that's the mentality
offense,
that makes people.
It's sad. I feel like we should. It's 2018. Other countries are doing really great stuff, moving great stuff, technological advancement, inventions, and all the really cool stuff. And yes, in Nigeria, sometimes the only thing they can think of is how. And do you know the funny thing? When you see the compilation of this so-called mediocre stuff, they are intelligent. You know, look at the way the guy remixed the beats, you know, that, and they put together.
And
I mean,
people
you
were
could have
dancing
used that brain to do something more noble, you know. Or call this guy, analyze it. There are people that could help, you know, just like you said. It could be a mental illness or imbalance or something. This guy should be clerked. If at least you're not going to help him, you know, don't make fun of him out there. I'm glad they made fun of him. At least he got help.
The people doing this, they would not give him any amount, any money from what they've made, because definitely for your video to go viral, you'd have a lot of followers. And in the bit of doing that, when you get adverts, you get money from that.
Yeah,
to show
selfishness, it's selfishness.
And this person that you're using to get famous would not get anything from it.
And talking of which, you know, before now, we've had people that went famous for viral stuff. And some of them, they got that fame, they got that rehabilitation at that moment. But I really hope that it is sustained. That is another headache. Okay, now this guy is getting help. He got a wardrobe upgrade, and I think he got a photo shoot or something to show that, okay, yeah, we're going to look into this guy. But then what is the aftermath of this moment of fame?
Actually,
and help?
that's another thing that I was concerned about. When I saw the pictures of him looking better, I'm like, okay, are you sure this person did not do it just to, you know, put him there for fame also? Are they really going to look into the psychological aspect of him not being able to spell? Are they going to help him have a proper health care? But I think for me, some Nigerians, at least they're doing something. They've changed his wardrobe. It's better than him just going and him just misspelling words like that. People going to meet him. Okay, spell this, spell
to analyze the deeper issue, yes?
We saw another video yesterday. For someone who cannot spell Buhari, you now went ahead to tell him to spell Chinchon. And I'm like,
oh, wow.
What
really?
Is that?
I didn't see that.
Yes, and something I realized and I saw in the video was that they showed him money. Like if he could spell Chinchon, they'll probably give him money
that
or
is
something.
Unfair.
And he was so confident in himself, and he goes like, okay, S-I.
Oh, wow.
But then, yesterday when I saw that video, obviously you would laugh because you can't imagine that there's someone who cannot spell well. You get, so you would still laugh, but then have a second thought about it. This guy needs help.
Yes, he
does. It is obvious he needs help, and it would be a great thing if Nigerians, you know, can come out and still do something aside changing the wardrobe and giving him good clothes. Still do something about the mental problem, mental issue he has. At least, because I still think that
we might need to just...
It is hard to believe that someone cannot spell Buhari.
Let's just leave that, please.
Oh, let's just go straight to the topic for today, which is...
Who needs eyeglasses? This is one very interesting topic because a lot of people... before introducing the topic, there was a time in secondary school that I was of the notion that intelligent people are the ones that use glasses.
Yes.
Nerds, you see some people using those
makes you feel like they are the serious
those really
ones.
thick ones, and you'd be like, no, this person must be intelligent. And then you feel like, yes, I need to go get glasses too. And some people that don't have eye defects, they go, oh yeah, I want to use glasses just because I want to have this look of seriousness. I want to have this nerdy look. I want to portray myself.
I have a friend that told me that she just loves the idea of wearing glasses. I'm like, okay, do you have any issue with your eyes?
I bet no. Exactly.
Okay, so why are you using glasses? Like, I just like the idea. It makes me look serious. It makes me look like I know everything in this world. I'm like, seriously? But then another concern I look at is that when you do this, does it not have any eye defect on you? Because as a long run, you probably have infection, because these glasses are meant to be prescribed to you. But then you just go to the roadside and then get any kind of glasses and put it on. And to you, you look serious.
For the professionals, to talk about that. Who needs glasses? Who does not? Who should wear glasses? How you should wear glasses? And a whole lot of that. Because it's a very, very interesting one. Talking about. Funny enough, okay, let me give my own experience. When I was in secondary school, I actually wore glasses.
Wow.
I had this sort of hypersensitivity, hyperphotosensitivity, which is like, I guess, sensitive to, too much light. I get to have this blurry, and sometimes my eyes are watering. So I didn't go to the specialist. I just feel like, okay, yeah, after all, I see glasses by the roadside. And
you just picked up one?
I picked one I felt like it was a shade, it was sort of blue colored. I still remembered. And then I picked it up and I wore it. Tentatively, it was a relief for the photosensitivity. But with time, my dear, I was getting headaches.
And there's this thing that happens when you wear glasses for long. Under your eye, I think it gets swollen.
Eye bags?
Yes, eye bags when you wear glasses for long, and then your nose here. There's a friend of mine that got like a dark spot around the nose because of wearing glasses. And I'm like, okay, when you do not have problem with your eyes and then you feel wearing glasses makes you look serious, makes you look intelligent, we need to correct this notion.
A whole lot that we are going to be correcting today.
And I am glad that we have guests do more justice to the topic.
Yeah, it's going to be a really interesting conversation. Yes, so don't even think of going anywhere because we got a load for you. We'll go on a break now, and when we get back, we will be going proper into the discussion. Don't move.
Angels from the realms of glory, wing your flight around the
Have a season of family adventure this holiday. High Impact Planet. Fun just got real.
Everyone's dreaming of being the biggest pop star on the planet. But today, for them, the center of the universe is right here. I know you from a poster I saw somewhere. Hey!
They're back! They're back! Neil! Neil! Georgie!
Where's my boy and my husband?
That's the Savages.
Where are they?
I met her in 1985. We got married in 1988. So we had like 3 years of courtship.
He can do feminine chores. I don't mean washing plates or whatever. He can come back from outside. He has gone to the market. He's bought meat, tomato, everything I need in kitchen to cook. I said, go to the kitchen, I got some things. He would do. Many men would not like to go to market.
Well, I was in England and I got a message from her. And that message made me love her. Well, it was an exam result, and I didn't do too well before I left for England.
Oh, when the father died and I wrote him a letter of condolence, he started writing letters asking me, and I wasn't even sure whether I wanted to say yes. And I was dodging the question. I replied the letter, but I was dodging that question for a while. And this musician was singing at that time, fire, 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 get on. And they said this musician should stop singing that song. Maybe that was the cause of the outbreaks. So I told him that story. He said, that is not what I'm asking.
You're welcome back. This is Tea or Coffee on High Impact Television, your favorite breakfast show. In case you're just joining us, you are very welcome from any part of the world that you may be watching from. So before we went on the break, we talked about today's topic, which is who needs glasses? And now in the studio, we have an optician with us who is going to talk more on the topic. Good morning, sir, and you're welcome.
Good morning to you.
Olastomi Olatunji.
Yes. Thank you very much.
Good morning. Good to have you on the show this morning.
Thanks, it's a pleasure.
Okay.
So straight into today's topic. Who really needs glasses?
Who really needs glasses? Well, it's a very simple thing because who really needs glasses has to do with the person, someone who has been examined by an ophthalmologist or an optometrist and has been certified that the person needs to wear the glasses.
Okay.
So the moment someone is being examined and we discover that he or she is refractive error, then such person needs to wear glasses.
Okay, you just mentioned.
And there are other areas, apart from being, being somebody who have gone through the examination and that we discover that it's refractive error. Okay. Some people may not be refractive error. Okay. And they may still need to wear glasses. So it depends on some issues.
Issues that you
like?
Issues like, for example, now, there are some who are non-refractive error.
Okay.
And find it very difficult to face light, most importantly, brilliant lights.
Oh.
They find it very difficult to face it.
Okay.
People like that, once we meet with them, though the number one thing we do is that, okay, they need to be refracted, at least to know the power, of the eye. So such people may not need to wear, but for the fact that they have photophobia, in as much they are unable to dilate the eye enough when they face the light, we call it their photophobia patients.
Okay.
So once you are a photophobia patient, you need to also wear glasses. Now on that note, such people they are not refractive error.
Okay.
Another area is that there are some that they may not have error in their eye,
Okay.
But some people, probably due to the nature of their work, they stay for a minimum of like 4 hours working with system.
Oh.
They need it.
Okay, before we go deep into who needs glasses, now a lot of people have notion that once you just have eye problem or eye issues, the first person you go and meet is the optician. So what is the key role of an optician?
Yes, thank you very much. Optician is a technician.
Okay.
Is a technician who has to design, fit the lenses into the frame, and virtually make all the necessary specification on the lenses that the patient will need to wear.
Okay. All right. So that is the key.
They are the
role.
one to design.
Okay.
All the frames you see outside, they are designer.
Oh, so
they
basically
design
they
it,
deal with the
they
technical
fit lenses,
aspect.
they do all those things. All the specifications that has to do with the a pair of glasses.
Wow.
So that means the optician comes and works basically with the refraction, if I get the word right, of the optometrist now.
Sure.
Okay.
They are the one to dispense. That's why they are called dispensing opticians.
Okay, they dispense their eyeglasses for
Yes,
the patient.
Interesting.
Okay.
So
Nice.
it's an intertwined network.
Sure.
That's interesting.
Yeah.
So talking about who needs glasses, there are some people that, just like you rightly said, they might not necessarily have a refractive error,
Yes.
and they might not have one problem or the
Or the other.
But yet they go ahead to wear these glasses just because of something they think might be wrong with their eyesight. Do you think, especially by the roadside, there are people that just get
Just pick up the
planes,
glasses,
yeah,
yeah.
by the roadside, and funnily enough, it works for them. Yes.
Okay. Let me start from where you stopped. Okay. It doesn't work with for them.
Oh.
It rather deteriorates their vision. It doesn't.
Wow.
But we think it's working, or the person may think it's working for him or her. Because by the time you visit your doctor, he examines you, you discover that what your eye needs is totally different from what you have been wearing. And at that time, it's possible you would have affected the eye to an extent.
Okay.
So it's not advisable that anybody who is feeling, number one thing is that you must have been feeling it by one reason or the other. Is it that from the lights, or is it that you are refractive error? You don't know.
Okay.
Seek for medical checkup. Once you go, to the hospital, ask for a doctor. They refract you. Once you know that particular power your eye needs, you understand it now. From there, if you are not, we know what to give.
Okay, so what you're trying to say now is that unprescribed glasses do actually have side effects on the sight.
They have, effects, serious one.
On your sight, right?
Yes, on your sides.
Okay. All right. Now, for the issue of Apollo, now everyone just feel that, okay, once you have that, the first thing you do is to go get glasses. Now, what are the eye problems or issues you could have that would make you, go get glass?
Yes. You just mentioned the issue of Apollo. Apollo, that's a name, popular, to everybody.
I was actually going to ask that because I think it is conjunctivitis.
Conjunctivitis.
So I'm wondering how the name
So
Apollo
it's an
came
inflammation.
about.
You understand it now? There is a way it happens to people. But one thing is this. Once you notice such thing, and what does it even mean? Conjunctivitis or Apollo is a pink eye.
Okay.
The color it gives you. The color could be irritating. You understand it? But it doesn't really affect your vision.
Okay.
That's why you see those people suffering from Apollo, they still see. They see who is coming.
But most of them tend to wear dark shades of eyeglasses.
It's because at that time, they are unable to dilate the eyes to withstand the intensity of the lights.
Oh, okay.
You understand it now? They'll be looking for probably sunshade or here and there. At that moment, you can't just go to the doctor and to refract you at the level of that, when you're experiencing conjunctivitis.
Okay.
They will first treat that one. That one goes along with drugs. When you are, when you are done with that, the eye becomes clearer. Then they go further to refract you.
Okay.
Because there are issues. There are some other things that, that could lead to conjunctivitis.
Wow.
It doesn't just, attach to people the way people see.
So
it's not an airborne disease.
Brings me to my question. So I know it's communicable. So how does it come about, actually?
Yeah, it's a communicable disease, not in the sense that whoever that is suffering from it, you try to stay away a little bit because the water that drains from the eye of the person, you understand it now?
Yes.
Whoever touches it can as well, catch up with that Apollo.
Touch in what sense? Is it that if you touch it, say a skin to skin contact, or maybe if it's you say you touch it and then you put it in your eyes or something?
The moment you touch,
okay,
there is one thing that happens to everybody. Per second or per minute, it will happen to everybody.
Okay.
Whatever, when you set out in the morning, you wash your hands.
Mm-hmm.
Between your house and your working place, probably you will have met other people, have handshake with some other people. Then that level, to you exchange pleasantries.
Yes.
But to scientists, you have just exchanged
germs.
You are getting it now.
Sure.
So that moment, you just pick your handkerchief, clean your face.
Okay.
Remember, you have touched it. You have equally, transfer those bacteria into that area.
Okay.
It's possible you are not touching that one, and somebody just there is a way, eye itching you. Just touch the eye. You have transferred the thing. So unknowingly, somebody who is suffering it, having tears, all those things like that, you must have touched whatever the person has touched.
Okay.
Unknown to you, probably you touch your eye, then you pick it up. So that's why you see some people in an environment of people that suffer with, that suffer conjunctivitis. They say, me, I'm strong. I look at your face, yet I don't have it. Then some don't do, they have it. It's not any one disease that you have to look at the face of the person and just get it.
That's the correct that.
So once you have it, that means you must have mistakenly touched
gotten in contact with the person.
material that belongs to that person.
Oh, okay.
Interesting.
All right. Okay. So next question: do glasses actually correct eye defects permanently?
That area is somehow, well, it doesn't.
Okay.
It doesn't. We use a language, or let me say the better language to use. Any corrective lens is a corrective one, not a curative one.
Wow.
Okay.
But to very many of us, when we say you are wearing glasses, it will correct your vision. Their mindset is that it will cure it. Not that language correction. There's a difference between correction, to correct, and to cure. To cure is when you wear it, and probably at some point in time, you don't need it again.
Okay.
But the area, that why I will say a little bit that it could cure. It has to do with systemic, individual body system. Some at the tender age, between the age 1 and age 18, something very fine will still happen to the eye.
Okay.
Because as you grow, your eye is also growing. So as we are aging, the eye is also aging. So a lot of things at that level could still happen. You understand it now? But the moment you cross over to that, from that 18 and above, forget about it. Wow. It could be corrective, not curative.
Corrective, not curative.
Not curative, yes.
All right, thank you so much. Still on the question, who needs glasses? Yes, it's Tea or Coffee on High Impact Television. And we still have the optician in the house, Olasomi Olatunji. But do stay tuned because we'll be going on a short break. And when we come back, we'll have the pharmacist in the house who will tell us more on the drugs and medications to use for eye defects. Do stay tuned.
Angels from the realms of glory, wing your flight around the
Have a season of family adventure this holiday. High Impact Planet. Fun just got real.
Everyone's dreaming of being the biggest pop star on the planet. But today, for them, the center of the universe is right here.
I know you from a poster I saw somewhere.
Hey! They're back! They're back! Neil! Neil! Georgie!
Where's my boy and my husband?
Past the savages.
Where are they?
I met her in 1985. We got married in 1988. So we had like 3 years of courtship.
He can do feminine children. I don't mean washing plates or whatever. He can come back from outside. He has gone to the market. He's bought meat, tomato, everything I need in kitchen to cook. I said, go to the kitchen, I got some things. He would do this. Many men would not like to go to the market.
Well, I was in England and I got a message from her, and that message made me love her. Well, it was an exam result and I didn't do too well before I left for England.
Oh, when the father died and I wrote him a letter of condolence, he started writing letters asking me, and I wasn't even sure whether I wanted to say yes, and I was dodging the question. I replied the letter, but I was dodging that question for a while. And this musician was singing at that time, fire, 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 get on. And they said this musician should stop singing that song. Maybe that was the cause of the outbreaks. So I told him that story. He said, that is not what I'm asking.
Have a thrilling and bonding experience at High Impact Planet Amusement Park and Resort. Enjoy an amazing retreat in our extremely secured environment with our breathtaking rides. Set goals for the upcoming year in our convenient multi-purpose halls. Bond between team members while giving your staff a desirable treat. High Impact Planet. Fun just got real.
When you think about it, there's a lot to celebrate in our lives. From the smallest milestones to our biggest moments, we'll pamper you at High Impact Planet. Whatever the occasion, let's celebrate you at High Impact Planet, where fun just got real.
We have been talking on the topic of who needs glasses with optician Olatunji, and right here we have pharmacist Tunji Phillips. I'm sorry, Kehinde Phillips. I gave you his name, yes. And then we're talking further on the topic of who needs glasses, and now we're going to talk about the drug aspect. So talking about glasses and eye care and drug use, are there drugs that can be used specifically for eye defects?
All right, thank you very much. Well, according to Vision Impact Institute, about 60% of the entire global population needs vision correction.
Okay.
And if you look at that statistics, considering the population of the world pegged at about 7.7 billion, it's quite disturbing. But the truth is, about 80% of the world population, or 80% of those affected, can actually correct, it can be corrected. 80% of vision impairment globally can be corrected. There are drugs that can be used, and there are eye drops too that can be used. It depends on the type of eye condition that you are talking about. Pharmacists are usually the first port of call before most of these patients even go to see an optician. Maybe owing to the number of pharmacies you have, in every neighborhood, you are most likely going to find a pharmacy there. So they come to us, okay, I have this, I have that. Sometimes it's conjunctivitis, sometimes it's just impact, minor eye injury, sometimes it's other eye conditions like glaucoma and cataract. And as pharmacists, we know where to refer, we know where to, cancel as necessary, we know when to give medication. So if it's eye infection, of course, you look for antibiotics. Sometimes it's just allergic reaction.
Okay.
It's not something serious.
All right.
The eye is itchy, the eye is teary. There are also eye drops and other medications that you can give for such conditions.
All
so
right.
not all eye conditions require glasses.
Glasses, okay.
Yes.
All right, you dispense drugs and he dispenses glasses.
Glasses.
Yes. Okay. So, my next question. Yes, my next question is for you, Olasami. How often, should one change prescribed glasses?
Yeah.
Yes. How often should one change prescribed glasses? Well, and we advise you need to just go for checkup annually. It's at least once, in a year. But that does not determine that your prescription has changed.
Mm-hmm.
You need to just, check. But one thing is that many will come and say, oh, my glasses has expired. That has always been the language they use. But the power in the lenses do not expire.
Oh.
You understand it now? They don't have an expiry date, but there are other things. There are some things that could happen to them that could make you to say it has expired because that's your language.
Things like?
Now, you understand it now?
Okay.
One, lenses could scratch. At that level, it won't give you the same vision it used to give
yes.
when the thing is very sharp, clean. It could be scratched. Then that's number one. The second thing is that you could outgrown the power that is inside the lens.
Oh.
Like I told you the other time that as we are aging, our eyes, is also growing as well. So, for example, now somebody who is being refractive error, and at the age of probably 18, and that this thing is, persisting, is growing up with it. Because there are some conditions that are very, they are like that. So those who are, they are myope and the rest of them, they are like that. So for example, at the age of 24, it's possible, if the thing will change, the power the eye will be needing at that age will be different from the power he or she was given at the age of 18.
True.
So the person wearing it, the wearer will be the first one that will tell you, this thing has expired. By the time they mention it has expired, we understand what they are trying to say. That is not really giving them the perfect vision that it's giving them.
Yes.
So at that level, we know they need to be refracted.
Okay.
At the level, and we notice that like 90%, that when you now refract them, you discover that the thing has changed. But that simply means that somebody somewhere could still need that same power that is inside the abandoned one, the one he or she is trying to abandon.
Oh, okay.
So telling you that the power does not expire, but you could grow older than what is the power that is there, and it could be a scratch thing. So then, coming back to that question, that how long, you can want change it. You may get they may dispense a glass for you today, and you come back next week and get another one.
A new one.
You may just pick it today, and while going on your own, you get lost.
Something happens to it.
Something may just happen.
Okay.
You may use it for like a month, and probably because you are carefree type, you just drop it anyhow. For example, now there are some people that once they off their glasses, they drop it on the table. Who knows? There could be sound particles on that table. For example, now that will scratch it.
Yes.
You come back and say this thing is not sharp. Those I've mentioned too. Another one is that there are some who are diabetic. Those diabetic patients, oh my God, they can change it as many times as possible.
Okay.
Why is that?
Why is that?
Yeah, it affects vision very well.
Rapidly?
Yeah. If you dispense for them in the morning, they may come back 12 noon and tell you this thing is not working.
Wow.
It's working, but that effect. You understand it now?
Okay.
It's really affecting them. So it now depends on who is involved in these things. So that means give us 3 people who are wearing glasses. Their complaints, their excuses will be different from one another. One could be wearing it for another 5 years and will still be saying this thing is sharp.
Okay.
And one could wear it for 6 months and say this thing I think is expired. But the truth is that it's not that it has expired. the thing has changed. What your eye needs has changed from what was given to you.
Okay, one question.
Okay.
For the farmers, he just mentioned a situation of one who is diabetic, and because of the rapid change,
yes,
they feel that the eyeglasses that they use needs to be changed oftentimes. Okay, so as a pharmacist, are there drugs in place that could help correct that? So they do not have to go to the optician at every point to change glasses.
Okay, with high sugar level, there is what we call diabetic retinopathy.
Retinopathy, yes.
And it affects the nerves. If you look at the eyes, there's a network of nerves that is directly at the back of the eyeballs. We call it the optic nerve. And it is connected to the brain. It sends signals and helps you interpret images when you see. So what we do is, we give supplements to diabetics that helps to strengthen the nerves and also the cornea and every other part of the eye. You have, and those supplements contain different molecules. It depends on actually what you're out to achieve. We have beta carotene, which is very, very good. About 50 milligram daily is ideal. You can get that from your carrot. About 1.5, about 1.5 cup of blended carrot will give you about 50 milligram of beta carotene. We have other antioxidants like your vitamin C. 4 cups of vitamin C is equivalent to about 500 milligram. That is the daily requirement. You have your vitamin E. You have your vitamin E there. Then you have your lutein. You have your the different vitamins really. And other trace elements too. Trace element like your zinc is also very, very, very important. So we have, I don't want to call the names of those supplements
no.
because we're on air, but
yes.
What we do is we give those supplements alongside their sugar control medicine, the anti-diabetic drugs to help their vision.
All right. Talking about supplements, actually, you mentioned that, and I think there was a time that I know it was rampant, yeast tablets. I really don't know if it works, so I would like you to shed more light on that. Some people just take yeast tablets. You talk about how pharmacists are the ones that dispense drugs, and then some of them can get it over the counter. So do yeast supplements actually work for correction of any eyesight, or what do they do?
Oh, well, we've seen all sorts. Some people come to the pharmacy with conjunctivitis and they request for yeast. And just recently I was forced to do a video to enlighten members of the public on the dangers of using urine, to wash the eyes.
Really sad.
It became very, very, very rampant. They come to the pharmacy and they tell me that there was one condition that actually pushed me to do the video. She came and her eyes was all red. Conjunctivitis is actually is not as big as people paint it. It's just an inflammation of the eyes, of the eyes, and it could make you to become more photosensitive. With time, usually even without medication, it's self-resolving, but just for you to prevent the symptoms from degenerating. So people come and they tell you, okay, I need yeast. They have impact, just minor eye injury, I need yeast. Yeast is a very good supplement. So you can't take that away for the eye. The same way your lutein and the other antioxidants help to, strengthen your eye or improve your eye health is the same way. That yeast, I don't want to go through all the mechanism of action and the chemistry that is involved. But yeast is a very good supplement that helps the eyes, but it does not correct eye infection. It's not for eye infection, it's a supplement. Supplements are used to improve your eye health. So when you have an eye infection, it is ideal that you use antibiotic. If you have an inflammatory condition, it is ideal that you use a corticosteroid eye drops. If it is allergic, it's advised that you use an antihistaminic eye drop. So yeast is something you use, especially with age, just like he mentioned earlier, macular degeneration with age. As you age, your eye ages too. So we give those supplements to really help eye health.
Okay, sorry, let me just ask this. You were talking about antibiotics, and then the research thing as antibiotic resistance. You were talking about eye drops, how some people just walk into the pharmacy and to get antibiotics, the eye drop, you know, the particular, a common brand one. So at what point does a person grow resistance, especially if it's without prescription, to these eye drops and the over-the-counter drugs?
Well, there is actually no fixed number of times to use eye drop before you develop resistance.
Okay.
What we advise our patients to, we advise them to be very careful with eye drop. Indiscriminate use of antibiotics.
That is the word.
Is one of the major reasons why WHO is crying everywhere. You know, we've not had new antibiotics in the past decades. So can you just imagine that the molecules, the common molecule like amoxicillin that you use when you have typhoid, can imagine you develop resistance to it. Although the amount of antibiotic that gets into the system through the eye is not as significant as the oral pills that you take. But still, when you use eye drop indiscriminately, when you really need it for that condition, it won't work. You know, it's like you bring you meet an intruder here, and instead of you killing the guy outrightly, you just hit him on the head and you leave him there. After some time, he gathers more momentum.
And fights
Then you will
back.
need a higher dose of the same antibiotics to achieve the same result. You know, so there is actually no fixed number of times to take antibiotics. We just advise that use antibiotics when the need arises, and use in the right dose.
That is
for
very important.
Yes, for the required number of days.
Okay. All right. Olasami, how do you, you know, determine, what is the process to determine, you know, one's prescription? Because like I said, a lot of people just feel that, okay, something is wrong with my eyes. The first thing to do is to go to the pharmacy and just prescribe any kind of drug for themselves, self-medication. So what is the process to determine one's prescription?
Yes. Like you said, I think, let me start from where you stopped the other time. That probably will put it in this way. Regarding eye now, there is no any issue that has to do with refraction, with your vision, seeing far, near, unable to see far very well, or near, those things. Up till now, there is no drug that will correct that. That's what you just said. You understand it now? Now, there are some other pathological cases, you understand, which we need to also, you know, go with drugs. Drugs to cater for that. For example, now somebody who just come to you and complain that is like, I'm unable to read tiny characters, tiny prints.
Okay.
You understand it now? But one thing we discover at the hospital is that these people would have gone to the pharmacist.
To get some kind
You
of
understand?
drug.
They would just go there, give me this. Thank God for the experienced pharmacist.
Yes.
They already know where they are going. You understand it now? So many of them will have, for example now, somebody who is experienced, who has a frequent headache, constant headache, could have known this thing has to do with your whether far or near. This is not a matter of paracetamol or analgesic. You understand it now? Because they will discover they have been on analgesic, on and on, headache keep coming. That's the eye. And you must be refracted before we know. So at what point will you know you are refractive error? One, when you discover that you are the type that has frequent headache, you need to quickly, you know, you need to check. When you strain too much,
To read.
fatigue, eye fatigue.
Okay.
You understand it now? You need it. At that time, you may need glasses. When you see now, and you begin to see halos, something like a cloud, you understand, around, you understand it now? At that time, you need checkup. You should know by yourself. At least the eye belongs to you. My
should be
eyes
able
is
to tell the
my side, so I'm
difference
the
in
one
it.
to.
Yes.
You understand it now? So there are some things that will make you to know. When you have frequent, how can I say, there are other things. You understand, that will make you to know this thing, I think the eye.
Something is wrong.
Something is wrong.
Yes.
But one thing they do, because like you said, you know, you see pharmaceutical, not even pharmaceutical, chemist. Let's use the word chemist.
Exactly.
Before you even say pharmaceutical store, you still, you
Just
know, move from
normal
one pillar
drugstore.
to. But these chemists, you know, wherever you can even see them from door to door. They just go there, Funniest thing they request for eye drop.
You even see some
Chloraphenicol
sell
is the
these
most
drugs by the
abused
roadside.
eye drop they go.
Yes, yes.
They abuse it.
Yes.
A lot.
And people don't understand the content in all these things. They look small, but they are very powerful. Most importantly, when you don't need it, the time you need it, it will not work.
Wow.
Do you understand that? So when they come, their complaint will determine whether they need to go through the test or not. We have whatever they say. So at the time you are experiencing those things, fatigue in the eye, you strain, even at the time you are unable to look at the light as expected, you need it.
Okay.
The only thing is this: no doctor will just look at you and say, "Oh, this is the type of eyeglasses you need," until you go through the process of the screening, which is the examination. Once that one is done, immediately you know the result. They tell you this is the way forward. The only thing you could know from by yourself is that it's like, I'm not saying far. It's like that's we have myopia, hyperopia, we have astigmatism, the rest things like that. They are like, for example, myopia now, they don't see far, they see near.
Short-sightedness.
Hyperopia is long-sightedness. They see far. Things coming near to them, they have challenges with it. Astigmatism patients is a kind of, it has to do with age. It's age-related eye challenge.
Okay.
And medically, we see that at the age of 40, most, like 70%, will have entered that age. They begin to complain. Oh, what I was reading before, I can no longer read again. Most importantly, the tiny print. I've seen a lot of people that will come, they are trying to change their Bible to a bigger one. At the end of the day, they still get to that place, they are unable. I said, no, it's not a matter of changing the size of your Bible. Something is wrong within the eye that you need to be examined properly. Once you know it, you still read your normal, I think that Psalm is one of the smallest literature we have in Christian. You still read it confidently.
Okay.
You understand? Because we'll try to maintain the iris and everything, you understand, normally, so that you don't overload the eye.
Wow. All right. Okay, we have a pharmacist in the house and we have an optician in the house. Which one of you administer drugs for eye treatment?
Well, we get the prescriptions from the doctors or the optician, as the case may be. Then we dispense the drug.
Okay, yours is to dispense. They prescribe.
We actually
okay.
Once at least that's what pharmacists will do for you. Those chemists may not do that. They just go there. I think I need. In fact, even the patient coming will even tell you, will dictate. I think I need chloraphenicol. They're standing now, regardless of.
Many of the times, you know when to cancel patients. Yes. Some of them just need rest.
Yes.
And we understand the importance of vision. Vision, you cannot talk about compliance without talking about vision. You don't give a blind man medication to take. How will he take? He cannot read the labels on the drugs. So we understand. We know when to, cancel them appropriately. Some just need good rest. For someone who has not had good rest in the past 1 week, his eyes are heavy. Okay. You think he has an eye problem. He comes to the pharmacy and says, okay, give me chloramphenicol eye drop.
Wow.
That's like,
just like that.
Yes, give me chloramphenicol eye drop. So we know when to cancel them. Sometimes it's even... abuse of some medication, overuse of some medication. I've had a woman who came to the pharmacy. One of her children in Germany sent her a multivitamin. Another one in London sent her another multivitamin. She was just gulping
different parts of the world.
Wow.
The same multivitamin. Every molecule you take into your system has effect on you. So sometimes what we just need to do is, okay, let's do a review of your medication. Okay. Sometimes you advise and counsel them on their prescription. Sometimes we just tell them what to eat, what to avoid, and all that. So we know where to draw the lines. We know when it is a minor eye infection or eye injury or eye condition, as the case may be. Then we know when to refer to our eye specialist.
Thank you so much, Kehinde Phillips. Thank you, Olasomi Olatunji. He is a pharmacist and you are an optician. Thank you for joining us on the show.
It's been a great time, talking about this and then dispelling the stereotypes and, of course, talking more about some things that people out there might not be aware of. I hope you've heard that now. Not everyone needs glasses. You need to go to get refracted.
That's,
and
that's the response to the
exactly.
question, who needs glasses?
Yeah, not everybody, you know, go get the appropriate attention, the right professional, you know. It's an intertwine, it's a network of the right professionals, the optician, the optometrist, ophthalmologist, the pharmacist, you know, so that these things can be holistically dealt with. So thank you so much for joining us on Tea or Coffee today. It's been a great time. And Wura, do you have any words for us?
All I can just say is that try as much as possible to check what is wrong with you before you just go ahead and get medications for yourself or glasses for yourself. Yes, this brings us to the end of the show today.
Yeah.
Thank you so much for joining. Thank you for watching. It's still Tea or Coffee on High Impact Television. My name is Wura Olapopola.
And my name is Oluwaseun Olusegun.
To have a great day. Bye.